Forget flesh, forget biology. Right now, I want you to see what you're really looking at. You're looking at a machine. It's been engineered with a kind of brutal efficiency, and its objective is singular: perfusion. The penalty for failure? It's absolute: system collapse. Stop thinking about flesh. Your patient is a closed hydraulic loop, and the only law that matters isn't medicine. It's pressure equals flow times resistance. This isn't a suggestion. It's the core schematic for the entire machine you're tasked with maintaining. And this is it. This is the whole game, the prime directive. Pressure equals flow times resistance. Your one vital sign, the single metric that tells you if this whole system is online or offline, is mean arterial pressure, or MAP. Now, this isn't just some number on a screen. It's the actual driving force pushing fuel into every single subsystem. If that MAP falls, perfusion fails. It is truly that simple. Okay, so to really understand the law, you have to know the hardware. The central pump, that's the heart. The high-pressure pipes are your arteries, and they're delivering hydraulic fluid, that's plasma, and red blood cells to every last component. The low-pressure veins, they're the return lines. And the ones? Well, think of them as the oxygenation radiator, refueling all that fluid for the next circuit. It's a perfect, continuous loop. All right, let's go deeper. We're going inside the left ventricle. But here's the thing, don't even think of it as a chamber. I want you to think of it as a forge. It is loud, it is violent, and it is the only thing keeping this entire superstructure online. So, this is absolutely crucial. The pump does not beat, it fires. It's a detonation. And that sequence is dictated by the ignition control module, a specialized network of wiring. On this fire, a short circuit, an arrhythmia, that's not some medical curiosity. It's a catastrophic timing failure, and it degrades a powerful, orderly sequence into a useless, chaotic vibration. The firing sequence itself is a three-stage mechanical event of incredible violence. First, you've got the intake stroke, which we call preload. Then, there's the immense resistance of the blast door, the afterload. And finally, the raw power stroke, the pistons fire. That's contractility. Let's break those down. First up, preload. And I want you to get the idea of muscle right out of your head. The chamber walls are like high-tensile, industrial-grade steel springs. The more they're stretched by the incoming fluid, the more potential energy they store. The Frank-Starling mechanism isn't biology. It's a fundamental law of physics. The greater the stretch, the more violent the snapback. So after the chamber fills, that intake valve slams shut. The only way out is through a massive weighted blast door, the aortic valve. And that door is being held shut by the back pressure of the entire arterial network. The pump has to generate enough force just to crack it open. That resistance, that is afterload. But even the best machines fail. And when they do, our interventions aren't therapies. They are emergency engineering overrides. So now we're going to review 5 critical system malfunctions and their corresponding fixes. First up, a fuel supply problem. The pump is a machine, and like any machine, it requires its own dedicated fuel lines. These are the coronary arteries. A myocardial infarction happens when one of these lines gets clogged with a kind of industrial sludge, a thrombosis. The section of the pump that it supplies is completely starved of oxygen. The pistons in that vector just stop firing. It's a localized power failure that can seize the entire engine. The override has to be immediate. To dissolve that clog, we deploy powerful chemical solvents, thrombolytics. To mechanically rebore the pipe, we use angioplasty. You have to remember, time is the enemy here. Every single second that fuel line is down, a piece of the engine dies. Permanently. All right, next malfunction, excessive resistance. Imagine the hydraulic vises downstream are clamped way too tight. The pump is straining against an impossible afterload. This is hypertension. The pump is fighting against this overwhelming back pressure, literally working itself to failure just to force open that blast door, cycle after cycle. So what's the fix? You have to release the pressure. We introduce vasodilators. Think of them as industrial solvents designed to relax that clamping mechanism on the pipes. This drops the resistance, and that eases the strain on the central pump. Malfunction number 3, tank overflow. The whole system is getting waterlogged, and a dangerously high preload is threatening the pump's structural integrity. In a state of volume overload, there's just way too much hydraulic fluid in the pipes. This is stretching those industrial-grade chamber springs past their operational call-lengths. They are right on the verge of total failure. The override is to open the relief valves. We administer Diuretics. This is a direct command to the filtration units, yep, the kidneys, to open their outflow ports and dump the excess volume. We have to get the system back within spec. The fourth malfunction is a straight-up power problem. The pistons fire itself, it's weakening. With weak contractility, the raw power stroke of the pump is just insufficient. Flow falters, pressure drops. Perfusion to critical components is immediately compromised. System collapse is imminent. So we do something drastic. We inject a synthetic fuel. The override is to administer Inotropes. These are high-octane chemical accelerants that force the chamber to contract with much greater ferocity. We are literally redlining the engine to keep the machine our mine. And our final malfunction, a timing failure. The engine is completely out of control. It's revving inefficiently and burning fuel at a totally unsustainable rate. This is tachycardia, and it's a fault in the ignition module. It's misfiring, causing the pump to fire way too rapidly. Now, it's not generating effective pressure, it's just vibrating chaotically, wasting precious fuel. The fifth fear, and this is key, it isn't more fuel. The fix is to engage the braking system. We administer beta blockers. These act like a governor on an engine, damping that frantic electrical signaling and forcing the pump back into a slower, more powerful, and much more efficient rhythm. So after looking at the hardware, the physics, and the common failures, we arrive at the final mandate. And this responsibility, it falls to you, the engineer. This is not an organism. It is a machine. It is loud, it's violent, and it's governed by the unforgiving laws of physics. Your job isn't to heal it. It is to understand its mechanics and to intervene with absolute precision when it fails. Because if you don't, you won't just fail the machine, you will be crushed by it. So, I'm gonna leave you with this. The alarms are screaming, the pressure is dropping, the schematics are in your hands. Which override will you engage?